Call the meeting to order. Say the Pledge of Allegiance, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please, Stacy.
I will go in alphabetical order. Mr. Jack W. Balch,
Present.
Mr. Kevin Hum,
Here.
Mr. Al Hueso,
Here.
Mr. Jack Rogers,
Here.
Mr. Craig Steckler.
Present.
Okay. Entertain a motion to either approve the minutes, or does anybody have any comments? So moved.
I'll second.
All those in favor?
Aye.
Opposed? Minutes approved. Do we have any communication?
There are no oral or written communications at this time.
Okay, project update. Bob, you ready to?
Before Bob gets started, no, come on up and have a seat. I just wanted to say one thing you might have noticed if you had a chance to go through the financials. I wanted to bring up early because I think it's going to color kind of each of the presentations, is that in the last quarter, the board approved a budget amendment for the project, and it was a budget amendment for things that were either additional scope, or they were things that there were allowances set aside in the contract with Rudolph and Sletton, and then as we got closer to it and their pricing came in, it came in later because we had redesigned a number of things at the beginning of the project. The allowances were not adequate to cover. So in particular, what I'm talking about is there's a canopy that covers the entry on the first floor that was not in the original scope, and the project had a sidewalk, an open sidewalk between the buildings. We knew that we were going to have to do something, but there was not a canopy that was acceptable. So that was done, and that was one item that was that's an added scope. That's one item that was new. Another thing was a hospital requested thing, which was, as we walk through, the main patient flow is in the basement, and the main public flow is on the first floor. And it was decided that we should put an emergency exit out of the emergency room department for the occasions that if somebody comes in either with something like a heart attack, or let's say they have an aneurysm, which is basically internal bleeding that needs to go to the operating room immediately. The thought process was, since both those things are on the first floor of the old building, the idea that you would take these patients that need to have a procedure done immediately down to the basement, cross under the basement to the elevators, back up, and then over to this part of the building, was that the thought process was we should have more immediate access. So it is an emergency sort of exit only out of the emergency room, directly under the canopy into the building. So that was added. That was not in the original scope. In addition to those two things, one thing that was found was that there are a sanitary sewer line and storm sewer access right in the middle of the walkway into the new hospital. So it was decided to push those out away from it in case, for the fact that if there ever had to be work done on those things, you'd be doing it right in the middle of the public access into the new hospital, which was thought to be not a desirable thing. We had that same thing when we designed the building at the emergency room exit too, but that was all caught ahead of time and all addressed ahead of time in our value engineering process. But since this wasn't designed until after we got started, that was when it was caught. Those are all three additional things. The other items that are included in the changes are the emergency room, the access to the ambulance entry, We did not have a very good parking arrangement, and we only had parking for a couple of ambulances. That was expanded so you could put 10 ambulances in there. It was between 8 and 10 at any particular time that they could all park there, have immediate access. The drop-off point did not have any parking right up at the front door, nor was there really a great drop-off point. So we put in sort of a landing area and then have some handicapped and other parking right up at the front door. And there was also the flow of ambulances out, things like that. So those things were all addressed. Another thing through the discussion with the board was that in our original scope and plan, we had the very back of the property, you might remember from different things, we had basically more parking at the back of the building. So there's a roadway that runs along the back of the building, and then there was parking back there. The board has started their master planning and are talking about putting another building in the back as the final part of structures going on the property. And we decided, instead of putting a couple of $1 million into the parking, just keep it as is. And so we took that out, and it's actually it's been redesigned. It's at Oshpot. It has to be approved, but basically the plan is, the only thing that was existing there that we had to address is the water runoff for the city of Fremont. And we had a fairly intricate bioswales and filtration through planting and things like that. And we talked to the city, and they basically said if we left kind of open space there with grasses and stuff like that, if we left enough of it, that would suffice, so we could spend as little money as possible out there, since it's going to become a construction site. And, no need to put several $1 million in there when we're going to tear it out, hopefully in a couple of years, since we have a 2030 deadline for the entire campus. So the outcome of all that was a $7 million add to the project, and the board approved that in, I believe it was November.
When you say the outcome of all that, all of the projects you just mentioned?
Yes.
Was $7 million.
That is correct. So those were and it was all either added scope or redesign that was additional costs. And we knew that we would have to go at some point, but we wanted Oshpot approvals on all those things. So when we started the job, you weren't here at the start of it, Jack, but at the start of the job, in particular, the attachments to the old building, the corridors were felt to be inadequate. So we took the one corridor on the first floor out of the job altogether. We had a corridor connecting in the basement level, and that got totally redesigned. So those two things were done after we started the project. Approvals gotten through Oshpot, and then we knew that at some point we were going to have to bid these and get prices for it because they weren't in the original scope.
So these revisions total $7 million. The board took action to approve
Yes.
funding for them.
Yes,
Was that bond funding?
yes, it'll still be bond funding. You'll see as we go over it, that our amount that we are going to have to use outside of the GO bonds and in the revenue bonds has increased because of that increase in funds. The GO bonds are set. We got what we've got, and we can't, no matter what we do out there in scope.
Money's money.
That's exactly right.
I'm assuming the finances and where this money comes from will be discussed when Chris has.
That is correct.
Yeah.
And so that's why I wanted to bring it up, because it kind of comes up through the whole presentation.
Okay, thank you for the heads up.
Okay.
Okay, with reading off on top of what Ed has mentioned there, the schedule for the most part has not changed. We still have our staff in stock, substantial completion date of June 11th. We're still holding to that. We feel that we can get the necessary things completed with this added work that will satisfy Oshpot to let the staff in stock. And you'll notice that at the three final items that are at the bottom of the schedule there are the ones that Ed just finished talking about. And those there are going to push out the occupancy date by approximately a month or so. We've met with Oshpod, we've put forth our plan on how to accomplish this, and they have agreed in principle to what we're trying to do. We're putting together an actual site plan specifically for occupancy for different stages. We've met with the city, they've also approved the plan, and we're meeting again with Oshpod tomorrow morning in the city next week. So the plan has been accepted by all the governing agencies, and we're getting into the detail with them on a monthly basis now. We're going to meet with all of them once a month. So that's the addition to the schedule that wasn't introduced to you prior. So, but before we go to the finance, did you have any questions on that portion?
Your comment about delaying it for a month,
It's going to be a little more than a month.
so that pushes it beyond June?
But the June was always the staff and stock, and the prior completion date was 2 months later than that, which was August.
Right.
You were now into September.
Okay.
So the staff and stock, in other words, when we can get into the building to start,
Yes.
has stayed, we'll either hit the June 11th date or we'll be very close to that. Original plan was final completion August 11th, and that's the one that's getting pushed out by the additional connections, basically. If you wanted to tentatively put anything on your calendar, the tentative date for the grand opening for the community is around September 15th.
But you get the equivalency of certificate of occupancy sometime in June, July.
Yeah, we've got, the problem with hospitals is we have to get multiple sign-offs.
Right.
So we get the substantial completion from Oshpod. We have then a period where there's got to be sign-off on a number of things before we get final completion.
So there isn't a clear-cut date.
There's not a clear cut because anything can happen in all these inspections.
Right.
Then after Oshpod signs off on it, we then have to have licensing come in from the state. And they do what could be, what's usually a day for a building, maybe it'll be a couple of days. You know, anything we do that's a renovation in the hospital that's going to be used for patient care, they have to come in when you finish construction and sign off on that.
It's a little more complicated than
It's
just-
more, so we've got multiple inspections that make it
Yeah.
difficult to say, this day we're opening.
Yeah.
We anticipate opening, honestly, right now, we're talking about the first week to 10 days in October, but that's as if everything goes according to schedule.
October, November is more realistic, worst-case scenario.
Yeah, for the actual patients in the beds.
Operations.
Yeah.
Okay, thanks.
So what may not have seemed a big deal, maybe to a lot, and that's probably a poor choice of word, was a big deal getting that poor last Friday to get all that stuff done in the front of the building, at Civic Center Drive, was huge to beat the weather on that.
Right.
And to get all that foundation work that you saw going on tonight was huge to get that before these rains come. That didn't get poured today, we could have been delayed another month with all the rain. Because we would have had to take all the steel out, we would have had to remove a bunch of the soil that's unsuitable because of its dampness, and start all over again. So getting tonight's pour was huge.
That's why they were
To
working
maintain
late.
this.
Yeah.
But that's why we're all here. That's why we've been hired to do this. We have these challenges, they're ongoing, but this was a nice demonstration to physically see some of these challenges, that it's just, you know, this isn't, as you guys, it's not cookie cutter stuff. It's, it is involved, but anyway, that's why we're here, so. Okay, the money on the next two pages, which says the cash flow, the cumulative, We've basically caught up with the aggressive original schedule, and we're almost evened out now. And of course, the work in the field demonstrates that there's not a lot of money left to spend overall. So we're,
Starting to flatten out.
money-wise, we're on the same pace.
I have a question. What, it notes change orders number 1 and number 2 at the bottom.
Change order number 1 had to do with, and number 2 had to do when we, as Ed said, when we resent the drawings in the OSPOD, we knew we pulled the stuff out, and we resubmitted the drawings to OSPOD. We had value engineering involved, and we saved about $3-4 million through the value engineering. And with the new drawings that went back in, the cost of the work came in still saving about $2 million, but we had to add $1 million back to RNS's contract because we deleted the whole amount and put back the amount of the change order itself. And that was a net of about $1 million.
Okay. But
So this is kind of, I'll try to summarize this as best I can. We have, I think we've talked about here, I'll try not to get into too much detail, but we have contractor allowances, contractor contingencies, owner allowances, and owner contingencies. To touch any of those, there is what we call PCOs, but they're sort of change orders, so that we get approval before any of those are touched, whether they're in the contract or whether they're in our budgets.
PCO, is that a plan change order?
Yeah, I think
Potential change.
Potential change order.
Okay, thank you.
So those are, so literally, I think it would be accurate to say there's probably a couple hundred of those, okay? And they could be about any particular thing. The vast majority of those have been for $0, but the rest have been, so let's, for just for simplicity's sake, let's say 50% of those have a dollar attached to them. We track those and apply those to the appropriate place. And then at particular times, the ones that have been signed that are for additional money outside of the contract get combined and made into a large change order that we have to approve. Only 2 of those at the time of this have been signed for this project. They cover a number of, they're not just one or 2 items. They cover a number of items. Ray will go over the total dollar amounts on those. And I think we're up to, right now, we have a total of 4 for the whole project as of today. And I think change order number 3 is in progress or has just recently been signed.
That just has been recently signed and has gone through all the hospital's
Right.
procedures and processes.
Right.
And so number 3 has been signed, and that's actually for the loading dock and the other ones that you just mentioned.
So it's I guess what I'm trying to say is, when there's a very few change orders in this project that are actually being additional dollars put into, given to the, increasing the contractor's contract amount. But they contain a whole variety of things that have been approved over time. I don't know if that's, so it's very difficult for us to say, well, change order 1 is this item. It actually is an amalgamation of multiple change orders. I don't know if that makes it clearer, but that's for the entire project so far to date, there are 4 change orders that are actually an amalgamation of all these other items. But those are the ones, they're important because those are the things that are increasing. They're giving the contractor the ability to bill an additional amount over what the contract is. Until they get those large change orders signed, we may have approved them, but they can't bill against them yet.
Right.
So
thank you.
from a process point of view,
Yes.
each one of these larger change orders may have subsets of maybe 10, 15 sub-change orders that gets rolled into one.
Correct.
And then what you're doing is that you have a process for reviewing that, I guess, hospital staff, contractor staff, sit down, agree that you're going to approve all this stuff, and then at that point it becomes real. And number 3 is in that negotiating process, I guess, right now.
Right.
Where it'll eventually either say, yeah, all of those subsets get agreed to, dollar amounts get agreed to, or gets amended and then approved.
Yes.
So,
It's even simpler than that, well, it's, or more complicated. Each individual item gets negotiated out and signed off individually, so the actual change order sign-off is not a big deal. It's already things that that they have been negotiated by Jacobs, you know, with my involvement or knowledge, and then they have to go through up to the CEO of the hospital to approve.
final approval.
Yes. So each one of those dozens that are in that have individually been gone through, discussed at multiple levels.
It's extremely well vetted, and not to complicate things, but the thoroughness is we have to make sure, which we do obviously, that there are no rates such as labor rates or anything else that are in excess of what's allowed in the contract. So, but you have to check all those, and so does the contractor, because you're relying on 75 vendors to put the stuff together, and some of them aren't that sophisticated, and they're just going to say, it's $70 or something. Well, we have to have the whole fringes, the whole break. So it's a very long, drawn-out process. Plus, we have KPMG that we mentioned before, the outside audit firm comes in and audits the work that we do every 3 months. And so there's all kinds of safety nets for this the money.
Jack, before you got on the board, all these change orders had been discussed in
Sure.
details, approximate amounts.
Good.
So, the stuff that's
Yeah.
passed has all been known.
Their
and the fact that-
potential was identified.
And the potentials, and it's always been anticipated that there would probably be additional change orders. We have,
I think my first meeting, you discussed the fact that, we still had these other change orders for the connections and other things.
and I'm sure we
Still
will
to
get
come, yeah.
that information again tonight on these other ones.
Yeah, thank you. Okay.
So this spend just shows that
is-
it's leveled out. Sorry, Bob, go ahead.
This is the last slide, which is also demonstrates the money on this. This is on a monthly basis, and the red lines are the actual monthly invoices, and the green was the forecast, and the red got ahead. Actual, as we talked about earlier on, back in August, July 16, that was all the equipment. And as you can see, as we got into the January, February, March, the red dropped below the forecast, and now it's pretty much balancing out in November and December, and will be pretty much as the way it depicts up there on the board. That's the way the job's going to finish out. So it's pretty, they've pretty well leveled themselves out now.
Okay.
Thank you.
You're welcome.
Good evening.
Okay, kind of give the big picture overview for a moment here with the dashboard that we are used to seeing. As Bob said, the building itself is moving along quite well, and when we look at the elapsed time of 83% elapsed time and 90% earnings, it tells us that the contractor's earning money at a faster rate than the schedule is proceeding. So the building itself is in good shape to reach the what's the contract substantial completion date in June and the final completion date in August, 2 months later. And I think everybody explained exactly how that goes in a stepwise fashion. When you reach substantial, you begin with a limited number of hospital staff coming in to get acquainted with operating the building, and then once they've got the building so it's operating, then they bring in the people that are going to have to treat the patients. They have to get ready, and when they have reached a certain point, as Ed was saying, that we first have to get OSHPD's approval, then we have to get the Department of Health's approval of the license. And those can generally go along concurrently, but both have to occur before the hospital can start using the building, which would be about October. But so the point is that the contractor's schedule is moving well to get the building, and you could see that most of that building is getting to the point where we can do a punch list and the contractor can then finish up the odds and ends of the work. So the building itself is moving well, and the main critical path right now would be several of the change orders. The most critical would be that area we walked out and saw them pouring the concrete. That's the loading dock and the connecting walkway between the two buildings. And that's very critical to get the walkway done so that when we are really getting ready to operate, the staff have a place to get back and forth. And then secondly, to have the second side of the loading dock completed. We're putting in a new loading dock on one side, and we're then refurbishing the old loading dock. So that will be really the critical path to getting that done so that the agencies can sign off and say, okay, you can use the building now. But anyway,
Ray,
yes,
what
sir.
is the route of trucks that are going to be using the loading dock? What's the route they're going to take to get to the loading dock? Are they going to come in off of Civic Center? Are they going to
You
come
mean,
off
how do we
Parkway?
handle the trucks while we're doing the construction? Was that the question?
Yeah, I just wondered where the trucks are going to get to the loading dock. What street are they going to come off of?
They would come off of the same one they normally come off. They would come off of Maury, come in that way. We generally don't let them come in off of Bart Way.
Into that second driveway cut between the hospital parking lot and the 1900 building?
That's correct. That is correct.
That's correct. They generally come in off of Maury, and there's kind of a turn where they come around the corner of the Cup building, and then
Right,
they get
yeah.
back down to the loading dock. And
That-
while we're
They
doing
either,
that-
Craig, they either come in right at the cut at the light, there's a light there, and they come in right at 1900 and then swing around 1900 and have a shot straight into the loading dock. Or they also can come in, there's a sort of a spur road that comes up between the 1900 building and the CJR.
Right.
And they can come up there and then take a right-hand turn. They take both ways in, and they come out the same way. So that's the way we're operating today. That's the way our deliveries are coming in today.
Couldn't improve that.
And we will keep operating during the construction by keeping one side of that loading dock area always open for the trucks to come in. It'll be a little restricted for a while, but you know, we can make it work. Did that answer your question okay?
Yeah, it just seems awkward to me. You can't get to that driveway if you're going westbound on Maury. You got to go
Correct.
down and make a U-turn and come back.
Correct. Or you could take if you're going westbound, you could take the traffic light, take a left-hand turn at the traffic
Yeah,
light.
and then go around the 1900 building.
Yeah. It's pretty wide open. And, you know, it's particularly in the morning when people are coming through. That's when the majority of our stuff comes in, really early in the morning through about 8 o'clock. And that's all pretty wide open. So we haven't had problems thus far.
No, thank you.
Okay, so I'd sort of moved from talking about the dollars up there to talking about the schedule. And I think the point is that there is a step-by-step process that we're going through. And our Jacobs folks and the other consultants have worked with the agencies to try to identify what they will allow us to do at each step. That is, we need to get egress to the building to get the staff in, and we need to meet, so they got fire and exits and all that. And then I believe that as we go, we'll just have to pace this based on how fast the work can get done. we certainly would like to not let the building itself be delayed by finishing up some piece of site work that's really not that critical to the operation of the building. And so we're hopeful that some of this site work that we're going into the winter on now will be ready to go, and if it's not 100% ready, it won't affect the building opening up and starting operation. We did talk a little bit more about change orders, and up there on the right-hand side, you'll see that we've approved change orders of about $1 million. And then in the lower right, it shows another section where it shows a requested and pending and approved, and it shows there a pending of $8 million, which is 4% of the contract amount. And the reason there's a difference between the $1 million up above and the $8 million down below is just what was explained about. There's two buckets in the contract. The contractor's bucket of funding for change orders, certain kind of changes, and then there's the owner's bucket for changes. So when we look at the bottom, that's really tracking the entire contingencies and allowances in the contract, as opposed to just where we have a physical change order that amalgamates the number of PCOs in it that's been signed by the owner.
Can I ask a question on that?
Sure.
So the 16 million, 16.6 is requested, and it's 8 hasn't approved, and the other 7 is still outstanding?
Yes. If it says pending, that means requested means the contractor's made a request, but with a PCO.
Sure.
And Jacobs is working with them to resolve that. And then the pending would be the difference between what they have approved or recommended the hospital approve, really.
So to just to visualize how that works, you staff and Jacobs has not approved that 7 that's still pending. You're still processing that.
Yes.
Okay.
Right.
And is that, do you anticipate that's going to be the total of the 16, or there'll be more after that?
We certainly would expect some more requests to come in, but when you're 90% done with a building, there's not much more contractor can request money for, right? I mean, the construction is pretty well done.
Been around
so.
enough contractors to
Right.
not to make any assumptions that way.
Right.
But it's looking at 18, 20 million maybe total in the future?
Well, we try to make projections, and we basically take the percent complete and divide that into how many have already been submitted, and that extrapolates you out to where you should be at completion.
It looks like that might be close to the final number.
Yeah, we think it's not going to be more than 10% from beyond where we are now.
Okay.
When I look at your numbers,
And you know, a request doesn't mean that we'll pay
It's
the
gonna be
contractor.
granted. You gotta
The
negotiate that, I know.
negotiation may yield a smaller number, so there could be a shrinkage
Sure.
in the approved amounts.
when I look at your change orders, if I add your pending and approved, that does not equal the 16.5 million.
You are correct.
Yeah.
Okay.
that's right.
So I'm just trying to figure out,
What it means.
yeah, what it means, you know,
What
because
is the difference? Yeah?
because do we have the approval, is that part of that 16 million?
The approval would be part of the 16 million that's been requested, right? And I think probably the difference is when you have a savings between what's been the contractor asked for and what's actually been approved, that changes.
No, it's the difference is strictly a timing one. So those two numbers that are up there are what Washington Hospital has approved and what's still outstanding, and the difference is what Jacobs has recommended to us to approve, and they're in process.
Okay, so there's
So
about
it's-
Right.
$800,000.
There's a
difference
lag in-
right now.
That's it.
in
That's what the
approval.
difference is.
Yeah.
Okay,
So
so,
they're in process, and I think it's safe to say we anticipate the difference being approved and falling into the Washington Hospital approved number. But there's between the time of negotiation and the time of final sign-off, there's a lag.
and, we've talked about this previously, that our allowance for change orders was minor, and we expected some. But I would think the only thing that would really change this aren't the change orders from what we would call conflicts, but new things that the hospital might be asking for.
Yeah, as Ed was describing about the change orders that we had planned for, those would be the major allowances, and that would include the loading dock and the plaza and the site work and a few other minor ones. But those were the big money items, and those have at this point been processed and recommended for approval. So there shouldn't be a lot more beyond what unless you're saying what might be a conflict or a omission in the drawing or something like that.
Yeah, if I can, I'll just, to quickly summarize what's in that $16 million. So we talked about at the beginning of this, there was a new amendment that was just approved by the board for $7.1 million. $6 million of that falls into the construction category. The rest would fall into architects and inspections and things like that. So $6 million of the $16 million is the new stuff. $4 million of it is for the loading dock. So in other words, we carried an allowance in our budget, not in the contractor, and we carried an allowance actually of a little bit over $3 million. The actual cost came in at $4 million. So the whole amount of $4 million goes into the change order because it's not in the contract.
It's in the budget, but not in the contract.
Exactly right. So that's 10 million of the 16. The other major ones that we've talked about here before was for the fire alarm. There was over $1 million in change orders for the fire alarm that was not in the original scope, and the security system, approximately $1 million there. The two together were over $2 million. So that gives you 12 million of the 16 million, and the other 4 is a long laundry list of things that were found in the field, error and omission type things and plans. I mean, we've got them all. We've got, and we can.
But it's such a small percentage of total contract.
Yep. So that's, yes.
So my question is, the 16,658,000, is that what you're anticipating we'll have to pay for, and actually those changes will be part of the finished product?
Yes.
Okay.
Yes.
So then, how much of that's, and maybe I'm skipping ahead to Chris's pages, but of the 16,658, how much of that is included in the estimated cost upon completion?
All of it.
All of it.
Yes.
We project to completion based on what we've already got in hand, plus a projection based on the time remaining to get where we think we'll be at on completion.
Okay.
So basically you had contingency set aside for these change orders.
Yes. And, frankly, we had set it aside, and we've gone over what we had set aside as contingency. I don't want to get overly complicated, but we had an owner contingency for specific things, like the loading dock. And then we had a project contingency in addition to that.
For unseen.
Exactly right.
More for the miscellaneous ones that you can't predict exactly what they're going to be, but you know you're going to have them. So.
Yes. So to answer your question, yes, the 16 million is in there, plus what we're projecting that could happen in the future. So what we're projecting is everything that that they've given us, that we have documentation on, and the cost for, that's all in here, 100%. Even if it's not been negotiated out, we've put in what they've told us the fee is. So that's, so it's everything we've received from them, plus an amount of things we haven't received, but we have 10% more of the job, and so sort of mathematically, we've extended, here's what our change order percentage has been so far. We've done an estimate. So we've got a very conservative, we've got a conservative number from the point of view of we haven't received these change orders that we're projecting we'll receive, and we're putting in the full amount, not the final negotiated amount on these change orders.
Good.
And just sort of FYI, we track what we get in savings in the negotiation, and it's over $2 million so far in the project in the negotiation. So we anticipate, this to continue someday.
Okay, unless you've got questions, that's pretty much my overview.
Thank you.
Okay, we'll jump into financials. So the first thing of note on this slide is the board-approved budget amendment. We've folded that in so you can see the roll-through of that. So the original budget on the project was a little bit over $346.5 million. With the board-approved budget, the lion's share of that going to construction. With that board-approved amendment, the new budget, or revised budget, is little under $353.7 million for the project. We ended, the last time we met, we had seen expenditures of $260.9 million in the current quarter, and this is, we're looking at the 3-month period ended November here. Another almost $16.6 million of spending. Again, the lion's share of that going into construction at almost $15 million. And then, the additional amounts for architectural and design fees, $750,000 for the construction management that Jacobs does for us. Permits and inspection, $258,000. That number largely composed of construction testing services and inspector of record fees. And then a small amount of equipment during the quarter. Bringing us to total expenditures to date of $277.4 million, with about $76 million left in the budget as of November 30th. So Ed, let's move forward. Project cost to completion estimate. Again, we're going to start with the amended project budget here. Total expenditures to date at $277.4 million. The estimate to complete is $73.6 million as of November 30th. Again, the lion's share of that is in construction and equipment. Equipment will not be reimbursed with general obligation bond funding. If you recall, general obligation bond funds are only allowed to be spent on bricks and mortar construction. Total estimate upon completion of $351 million at this point. Again, that's up a bit from the last time we met, but Ed and Ray have explained that. Leaving us projected to be coming under budget about $2.6 million under this total expenditure number, but we're being a little conservative here, so we'll see how things wrap up. I think when we meet next, we'll really have a good handle on where we're headed and really wrapping things up. So, any questions on this slide?
$64,000 question. Geo bonds issue is sufficient to cover all of this?
Okay, well, that's the next slide.
The one thing I would point out, if I can just interject, sorry, is one thing that's happened here on our budget that's been to our advantage is that our equipment expense, or our actual costs, are going down significantly from what we had anticipated. Two things: we're reusing as much stuff as we can to bring over, and two, we ended up negotiating prices and things so that we're able to come down a couple million, about
almost $6 million.
Lower than what we had anticipated. That's helping us in our overrun of our construction, and we hope, knock on wood, that next time we meet, our construction number to the end may even come down a little bit, maybe, because we've basically thrown the kitchen sink in there of what we think we could get hit with in terms of change orders to the end of the job.
So, before we leave the expenditure side, then, if we take the total anticipated cost, 351 roughly million, divided by the square footage we're building, Kevin, is that fair to come up with a cost?
We'll bring that to you.
And then how do we compare with other other,
With the market now?
yeah,
Yeah,
projects.
I think likely we're going to come well under the current market.
I would hope so.
Yeah, and the reason being is that since we inked this contract with the contractor, inflation has skyrocketed.
Oh, the building,
Yeah,
look at
yeah.
Facebook on the other side.
So our timing was very good on when we inked the contract on this building.
And it's a testament to the construction management.
Yes.
That's what it's.
Yes.
So, but I'd love to be able to compare
Sure.
that at some time.
Sure, we'll bring that, the next time we meet. Okay. So to answer your question, Mr. Huezo, we never anticipated the general obligation bond funding to fund the entire project. We had always anticipated using other sources of funds. So when we started this project, we had, well, if you fold in that little bit of interest we've earned, 290 million, almost $290.3 million of general obligation bond funding.
So we're about 60 under.
Yeah, yes. Of that, we have drawn 271 million. There's about 18.7 million of GO bond funds remaining as of the end of November. So the additional sources of funding that'll round this out are, I'm going to go to the smaller ones first. There are Washington Hospital Healthcare Foundation pledges. They have been raising money for this project all along and have raised at this point an estimated $4.2 million. There's $2.7 million of funding that are actually a relic of a bond funding and a joint powers authority that was created in 1985. And there was money left over when that was all done. And when they unwound that joint powers authority, they earmarked that leftover money for a new ER. So that money is going to be used in this project. The rest of the money will come from a revenue bond that we issued about 6 months ago, about $38.5 million. Right now we're anticipating using almost $21 million of that to finish up the construction on the building and possibly fund some of the equipment. And then the rest of the equipment funding will come out of the hospital treasury. So we're in very good shape.
By the time we get done, the contribution of the treasury, the general funds from the hospital.
I would say at this point, likely to be anywhere from 8 to maybe 12 million.
So it's about 10, roughly.
Yeah, 8 to 12 million. We'll have to see how the job lands, but I don't see any problem.
Included in the foundation or outside of the Fremont Bank contribution
Yes.
and all that.
Yes.
Yeah.
Yes.
Great.
So that's where we stand on sources and uses of
You
funds.
can
at
pull
this
it off for
point.
10 million. Congrats.
Well, that's what we kind of estimated from the beginning.
Yeah.
So we're keeping within.
Okay. What will happen with the unsold authorization on your revenue bonds? If there's... if
It's
you
all
don't need it?
sold. It's all sold at this point, and so that will be used towards funding the equipment. The 18 million left over from what you see here would be go to funding that $27 million in equipment spending.
And there's a revenue source to cover that.
Yes.
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 Whenever they check someone into the hospital.
Or the future patients.
Okay, any other questions, Mr. Henry? Mr. Fain?
The only other thing that's been sort of new that has happened since the last time we met is at the hospital's expense, we've hired a firm called Callison RTKL, and it's a firm that we're calling a transitioning firm, but it's basically somebody that is going to be working with us through the move. And it's basically going to be coordinating a lot of the stuff that has to happen both pre-move, during the move, and then immediately after the move. So they're helping us come up with everything from staffing plans, because as you're moving between these two units, we're going to have additional personnel. As you're running one ER, the plan is that we're going to be moving the medical and critical care department, med surg and critical care. One day, everybody moves across. ER will, at a certain point, start admitting to the new one, and then let the census dwindle in the other one.
Over time.
So you got to do staffing plans for all that, not to mention what are the staffing plans for housekeeping and engineering and all these types of things as we get into larger square footage. And then also all the transitioning of all the systems. And that's every system from the phone systems. And we've been planning for this, so we've been actually budgeting on the hospital side to make changes, but to make sure that we go through a process of the phones tie-in. Epics and all their associated computer systems are working on both sides. The tube system that serves this side but has its brains over on the hospital side is tied in and functioning. We've got over 25 systems that have to be integrated and working before we move in. And it just kind of goes on from there. What's the communication plan to everybody? What are we doing with phone directories? All that stuff has to be worked out. Then, as we talked about in the walkthrough, everybody has to be now oriented to what's the fire alarm system, if we, in the event of an evacuation, how are we getting everybody out? And this is all new for everybody that's going in that building. So there's a whole sort of orientation and teaching that has to go on. So it's again more complicated than I'm going into right here, but it's a whole planning session that's going to go on for the next 6 months as we get ready to move over there, and then run things for a while in both places. So that's going on in the meantime. Okay, and that's being paid not out of these funds, that's paid out of the hospital. Yes. Anything else that we can think of that we haven't covered here?
Okay. Our next meeting is April 18th. And if nothing else, meeting adjourned. Thank you.
Great job.